Hey, everybody, welcome back to Firm and Final. A quick 5 minutes with what's going on in the stop loss industry. And for today's topic, I thought I would talk about industry reports. And in our industry, there's some fantastic reporting that gets put out by some carriers like Sun Life and Tokyo Marine HCC. They're always doing trend studies with their stop loss policyholders, and they have access to so many policyholders, so much data that they're able to report out on it, and it's fantastic. We have that as a resource to us. Stealth and Amwins, they put together a really nice market study that tells you a lot of things that are going on in the stop loss and reinsurance industry. But for today, I want to give a little props to Aon. And Bob Black and Stephen Kalk put together the 2024 Medical Market Research Report. And the one piece of data that sticks out in there that I want to talk about today is loss ratios. We're always talking about how are carriers doing in this space? Are they making money? Are they not making money? And typically, people will go to the NAIC. They captured for the entire market and then down to specific carriers that are in the market. But then Aon took it a step further and actually like segmented the market into various segments. So you have the top carriers in the space, you got the health plans, you got the Blues, Aetna, Cigna, United, and then you even have carriers that are being supported by MGUs and reinsurers. And I just thought it was a really nice set of information, and I wanted to talk about it today. When you look at the market in 2023, according to this Aon study, the loss ratios actually slightly came down, which is better for carriers. We went from 84% down to 81%. So the question is, are carriers profitable at that level? And when you think about all the fees that are built into the retention component, there's premium tax, there's broker commissions, there's fronting fees, there's underwriting fees, and then there's also just pure margin that needs to be built into those rates. You start realizing that maybe there's not that much to go around when you look at that 81% number. But here's the reality. If you break that out into the various segments, so you have the top 20 carriers in this marketplace, they make up 80% of the market. You see the loss ratios start to look a little different for those top 20. When you take that top 20 and you take out the Blues, Aetna, Cigna, and United, now all of a sudden you see that the carriers are operating at some better profitability levels. If you focus in on the Blues, Aetna, Cigna, United, it's a bit of a different story. Those loss ratios back to 2021 are elevated, and they've come down, which is great, but still much higher than the market. And then if you look at the carriers that are being supported by MGUs, you see that their loss ratios have gone up since 2021, but generally more profitable and operating better, performing better than the market. So, why is that the case? Why do we see such differences in the loss ratios? If you look at the Blues, Aetna, Cigna, United, stop loss is not their only source of revenue when it comes to working with an employer group. They're collecting administrative service fees. They're collecting PBM fees. They also probably have some programs, some wellness related programs, some other medical management type of programs that have fees associated with them. And all those different areas can drive some level of revenue and margin, which means they probably have room to subsidize the cost of stop loss coverage. And so that could be one of the reasons why those loss ratios tend to be a little bit higher. When you look at the carriers supporting MGUs, now that's a really interesting space. You see that their loss ratios are performing much better. And if you think about the reasons why, in that space, I would bet you the decline ratios are higher. And that's because those carriers, those MGUs, are following an underwriting guideline given to them by the carrier. And so they want to ensure that they're following the guidelines given to them. And so when cases fall outside a certain comfort zone, those are the cases that the MGU is going to decline. Not only that, their business is driven off of underwriting fees as well as a profit commission. And that means the block of business needs to run profitable. And so they're going to be very mindful about the type of business that they're looking to write. So, are carriers doing well? Are carriers not doing well in the ESL space? Well, here's the answer right here. You have a wide range of results. And if you want to dive into this report a little bit further, please contact Aon. And I won't distribute this report. You should get it directly from them. That's it for this week. We'll see you next week.